I'm Terry Therneau. I'm a Professor of Biostatistics in the Department of Health Science Research here at Mayo. And the article I'm talking about is the incidence of monoclonal gammopathy of undetermined significance and estimation of duration before first clinical recognition. As a statistician, I work with a large number of physicians on different projects, and this, my work here, like many, started with a question from a physician who said, when I see a patient who has a disease, is there a way to know how long he's had it? And it took 3 years from the time he asked that question until we figured out a complete answer. And the article was part of that answer. And in this case, what's really interesting, I think, about this research is we think of a patient going through multiple stages of the disease, from unaffected to having the syndrome discussed here to where it goes. We were able to answer his question because Mayo studied this for so long that we have different studies on different stages of that process. We get to see the whole thing. And the answer we needed to get of how long do you spend, if I see you here, how long have you spent somewhere else, required that type of a research plan, which in this case is 40 years of Bob Kyle. And we made use of multiple studies he's done over the years on different aspects of the disease and put them together. For most studies, you can't see the whole picture. It's like trying to deduce a house from looking at one room. In this case, we had all these studies together that we were able to look at the whole picture and come up with a notion of how long people have had the disease. And the answer was a big surprise at the end of the day that said that when they discover someone with this condition, they've probably had it for over 10 years, which changes their clinical thought process, essentially, I think, in terms of the notion of whether something has to be done this afternoon. The mathematics in it is a little complex. You know, the fact that you know that they've likely had it a very long time just changes the perspective of how they think about it. I think it fleshes out, you know, much of this started a long time ago when Dr. Kyle would notice patients with this unusual lab result, no evidence of disease, and the title of this condition, monoclonal gammopathy, undetermined significance, represents his thought at the time that he had no idea whether this was worrisome or not. And this kind of fleshes out and says that not only are there 3 or 4% of the population of Rochester over 60 have this, but most of them have had it for 10 or more years. It says that that's something that's just a part of the population and changes the way we think about it. Yeah, he's done a lot of work on what happens next. This paper was saying what came before. Okay, so more of a where did the immigrants come from than where do they go. So given all the other things they had, there was an intuitive sense that they know there's a lot of people with it. They know that not much happens to them. So there can't be very many new cases each year, right? Because you aren't losing any old ones. And if there aren't very many new cases each year and there's all these people with it, then they should have had it for a while. But what this did is it quantified that very nebulous had it for a while and was able to get some very hard numbers. And again, the number, when it came up as 10 years on average, was a surprise. Then they said, oh, I didn't think they had it that long. The other implication of it, which has changed Dr. Rashkumar's thinking a lot, is by and large, Bob's been focused on people over 50. That's where most of the studies are. But this means that there must be some people in the 40s with it, or the 30s with it. And so a further research project Dr. Rashkumar is facing up is trying to trace back just how early can it occur. Underneath the covers, your body makes a large number of immunoglobulins. And there are, this is my understanding as a physician, your body makes this wide range of them randomly, and then the process is fascinating. Basically, a cell makes some, and it waits, and if what it made reacts to anything, it says, oh darn, I made something that reacts to me, and it goes off in a corner and dies. But if what it makes doesn't react to anything, it says, oh, I've got one, and it goes off and it makes it for the rest of your life. And the things it makes are essentially a kick-me sign. They stick to something new and they flag it for the immune system to grab it. And what he's studying is all these when that process isn't quite right. MGUS is funny it says that 1% to 5% of your immunoglobulins come from a single cell. As I said, it's a little like going to the cities and finding out that 1 person in 100 is Bob Kyle. It's not enough to make anything break. Everything still works fine. But what am I doing with 1 out of 100? Because you're supposed to have about 10 million unique ones. What am I doing with 1 out of 100 being all the same? That's an abnormality. Free light chain is another facet of detecting things that are not quite what they should be in terms of how they're being made. But it's a funny disease in that sense, and it's completely benign. But when you think about it, it's really very unusual to have that population. For me, it's a little bit on the resilience of our immune system. So here's something that says there's something that's not right. It's really quite a bit not right, but it still works pretty good. And it doesn't really cause any troubles. What he's found over the years is people who have this condition, it is a marker that you're more likely to get a particular cancer, but it doesn't cause you to get more heart disease, it doesn't cause you to have liver disease, it doesn't cause your kidneys to go bad, it doesn't, So here's this disturbance in your immune system, and you still work just fine. So it kind of tells me that there's a lot of safety margin in the manufacture of the body.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.